Hi, this is Dr. Stephanie Lucas. I shall review the signs, causes, prevention, and treatment of low blood sugars. Our goal is to maintain fasting blood sugars between 80 to 130. Blood sugars 2 hours after meal should be less than 180, and blood sugars at bedtime should be greater than 100 for most people. Hypoglycemia occurs when the blood sugar is less than 70. Severe hypoglycemia occurs when blood sugar is less than 50. Common causes of hypoglycemia are taking too much insulin or taking the insulin incorrectly. Certain medications can also lower the blood sugar. Decreased food or carbohydrate intake, skipping meals, increased physical activity, alcohol intake, and certain illnesses can also increase the risk of hypoglycemia. The goal of the Diabetes Reversal Program is to decrease or eliminate your need for diabetes medications, especially insulin. The combination of lowered carbohydrate intake, change in medications, and increased physical activity usually decrease the amount of insulin that you require. If you develop a low blood sugar, it means that you must lower your insulin dose. Use the insulin adjustment guidelines that we have provided to decrease your insulin dose. Symptoms of hypoglycemia include shakiness, sweating, dizziness, confusion, difficulty speaking, hunger, weakness, fatigue, headaches, or a nervous feeling. With severe hypoglycemia, seizures, coma, or death can occur. The only way to know if you have hypoglycemia is to check your blood sugar with an FDA-approved glucometer. Some patients with diabetes, especially those who have had diabetes for a long time, may not feel symptoms of low blood sugar. It is therefore important to check your blood sugar before and after exercise, with illness, with change of medications, and before driving or operating heavy equipment. Also, always wear diabetic identification and carry a list of your contacts and medications. Always treat low blood sugars immediately. Switch to a glucometer if it is available, and use the rule of 15. The rule of 15 means take 15 grams of carbohydrates, recheck the blood sugar after 15 minutes, and repeat until the blood sugar is higher than 70. Try to determine why the blood sugar is low and eat a snack with a protein source such as a peanut butter cracker to sustain blood sugar levels. Do not take insulin if your blood sugar becomes high during this period. 15 grams of fast-acting carbohydrates can be found in glucose tablets or gel, or in 4 ounces of fruit juice or soda, 8 ounces of skim milk, 1 tablespoon of sugar or honey, or in a small amount of candy. Do not eat carbohydrates with fat or protein during the immediate phase of hypoglycemia because it might slow the digestion of carbohydrates and the sugar may not rise fast enough. These foods may be taken once the blood sugar has been corrected to maintain blood sugar levels. A blood sugar less than 50 can cause seizures, coma, or death. More carbohydrates are required to correct the low blood sugar. If alert, use the rule of 15. However, give 30 grams of carbohydrates every 15 minutes until the blood sugar is greater than 70. Always try to determine the reason for the low blood sugar and work with the provider to adjust your medications as required. Glucagon is a hormone that breaks down stored glucose so that it can raise your blood sugar quickly. If you are unconscious and cannot take oral glucose, a friend or family member may be able to arouse you by administering glucagon. After they administer the glucagon, they should call 911 and turn you on your side if you are still unconscious. Some glucagon injections require that you mix stir water with the glucagon, shake, and then administer. Some glucagon kits are premixed and just require that you remove the cap and administer. And some glucagon preparations can be administered through the nostrils. Check the expiration date, request a new prescription when that date is near, store as directed, and have it available in a designated place at work and at home, and train family members or co-workers on signs of hypoglycemia and how to administer glucagon. It is important that you educate family and co-workers about diabetes so that they can support you and identify when you need extra help. Work with your provider so that your medication can be adjusted to improve your time in range and avoid hypoglycemia.